Can I just check that you can hear us?
Yeah, I can hear you very well. Yeah.
Victor, can you hear?
Yes, I can hear you, Andy. I can hear Robin.
Yeah.
Can you hear me?
Hi, how are you, Victor?
Yes, we can hear you very
Great.
clearly.
Hi, it's great. All right. So all of us are around the world, correct? I mean, around the world.
Yeah, we haven't got Sherilee with us yet, I don't think. And Deoraj said he may not be able to come
Right.
for family reasons, but they have a recording.
Okay.
Yeah.
Hi, Andy.
Hi, who's that?
Hi, everyone. I'm Courtney. I'm
Oh, hello, Courtney.
hey,
Yeah.
I'm working with IAP. So we're trying to get Peter online. Andy, do you need him still on this session?
Sorry, who's that?
Peter McGrath.
It would be nice to have him, but it's not essential. We can manage. But is Sherilee coming?
They accept. Yeah, she accepted the link. I can send a reminder.
Yeah.
All right.
And I know Deoraj said he may not be able to come for personal, for family reasons in person. So Courtney, when we start, shall I introduce all four of them?
I've got Jackie here as well.
Oh, Jackie!
Hi.
So lovely to see
So are
you.
you good to speak at the session?
This session.
Yeah, that was on the NASAC.
No, but Deoraj already sent an
He did, Jackie,
For
but
the
he may not.
for the Q&A.
yeah, for the Q&A.
Q&A.
Yes,
Okay.
Yeah.
Can you join?
Yeah.
Can you get on your computer and join this?
Yes. Okay.
Like
That'll be great,
Yes,
Jackie,
yes.
if you could join us.
Where are you? You're outside, correct?
They're in
I'm-
Arizona.
yeah. Outside the conference room.
All right.
Yeah. Okay, so we are still Sherilee. Yes, I'll send a reminder with the links.
And Courtney, can I just clarify? I should read I'll introduce all of the four speakers at the beginning rather than between the recordings. Are you just going to run the recordings one after the other?
Yes, that is the plan, if that works for you.
That's good. No, I'll just introduce everyone at the beginning and read a very brief bio for each person, and then you run the videos, and then we have a
Yes. And actually, if you just want to say name and affiliation, we can put the link for all the bios in the chat.
Oh, okay. Okay. I was going to just say a few words, but yeah.
Okay, yeah, then that's perfect. Do whatever you plan. I'm gonna have Jackie come out here. She's physically in the conference room.
Yeah, can you can hear me? Sorry, I'll just turn this down.
I don't see.
Oh, really? Well, on the, okay. I'll send a message to.
Can you send a message to them that I am not?
Yeah. Okay. Just hold on.
Who is that, Robin? Who's talking?
Sorry. Can I?
Yes. Sort out whatever you got to sort out. Yeah.
Okay. Courtney, do you have a link for Volker? He can't seem to connect.
She can't hear. She's having a chat with someone.
Who else have we got here?
It's up, and I'll be right there. So Courtney, Peter has an issue connecting. So what I think I will do is ask him to sit on my seat, use my laptop, and I will rename myself so that Peter appears. Maybe Courtney cannot hear me, but that's a message to Nikki, and I don't know if John is here.
Ronnie, can you repeat that?
Right, okay, so Rania or Courtney, Volker can't connect. He doesn't have the right link, I don't think. Can you resend him the link that he should be using because for his final comment?
It is the link that is in the invitation. I can.
Yeah, but his name's not on that little table.
Oh, hold on. Go. Okay. You can use.
Ambassador for
Yeah. So I've asked Courtney and Rania to resend you a link because you're not on the table, but the rest of us are.
Is he a participant right now? Let me see.
So, yeah,
we can promote him. There we go. Should happen in just a moment. All right.
As the in-person participants begin to take your seats, please make sure your Zoom mic is mute and also the sound from your computer is off completely so that there's no interference. And we should be starting in about 4 minutes. So you can start connecting to session 2 and you will be admitted exactly at 8:50.
So Andy, I believe all the speakers are here. Is that right? So just a general housekeeping. So we please when we launch the session, it will just be the moderator to make some remarks. Please, speakers, shut off both or mute yourselves and also shut off your camera. And then we'll go through the videos after Andy speaks. And then after that, we'll open it up for live Q&A. So at that point, that's when you need to turn your cameras on. Are there any questions about the session or anything else before we start? Okay, hearing no questions.
Sorry, I didn't. I just was out of the room for a moment, Courtney. What were you asking?
First of all, on my end, I'm seeing all the speakers. Is that correct? And then what we'll do is I'm asking everyone who is not you, Andy, to mute themselves and turn off their camera during your opening remarks. We'll play the videos. Please remain muted and camera off. And then after that, we'll open it up for the live Q&A. And that's when everyone should turn their cameras back on.
Yeah. And the questions will appear in writing in the Q&A, or will it be hands up?
Yes, they'll appear in writing.
But what about people in the room? Will someone be fielding questions in the room?
So everyone in the room has their laptop in front of them and has been instructed to submit written. We did have one person asked to do an in-person question. That's going to be a little bit of an improv if that happens, but formal instructions have been to put it through the chat. Okay,
fine. Yeah, great.
Andy, I don't know, can you hear me?
I can hear you very clearly, actually, Peter. Yeah.
Good. But I won't be speaking like this when the session starts. But I'm here to help you. If you need help with questions, if there's too many to meet through, I'm here to help.
That's very helpful.
I'll figure out, but just call on me to read the next question or whatever.
Yeah. And if I lose contact suddenly, Peter, and we need someone to take over on site, I guess you can do that.
I'll try and do that, yes.
I don't think I will. I haven't up to now, but we're also I think Deoraj has joined us. We weren't sure whether he would. Deoraj, just can you confirm whether you're actually here? in cyberspace?
Yes, yes, I am. I am in cyberspace.
Okay.
Okay, well, thanks so much for joining us. And I see that Jackie Caddo is also in the room, so we may also bring her in at some point.
She's sitting over there across from me. So.
Yeah, great.
Courtney, we will, okay, he's already renamed himself. Peter, can you do me a favor and push your laptop camera back just a little bit?
That's a good question.
So we can get your whole face.
I will slouch.
Okay, that's
low,
better.
But you're not going to see me on the screen anyway. So.
Oh, okay, okay. That's a better look though. Okay. You all are actually ready to start whenever you're ready.
Okay, shall I start with a brief introduction? Can everyone hear me, first of all?
Yes.
Good. Well,
I should.
hello, everyone. My name is Andy Haines.
We need to hear the presenters from the room.
Andy, just ask everyone to mute when they're not speaking.
Could you all mute your mics when you're not speaking? Because we're getting a bit of echo, I understand. So if it's everyone's muted, it should be better now. So, well, welcome everyone. My name is Andy Haines. I'm the co-chair of the IEP Working Group on Climate Change and Health. And it's been an enormous pleasure and a privilege for me to work with my colleagues around the world on this really quite substantial project, which involved about 80 scientists from a whole range of different countries, different perspectives. And what we're trying to do really was to summarize the evidence of the linkages between climate change and health, but not to stop just there, but also to look at the actions that can be taken to reduce the impacts of climate change on health. And of course, those actions fall into two broad categories: adapting to the climate change that we can't prevent, and mitigating, cutting greenhouse gas emissions. And cutting greenhouse gas emissions also has big benefits for human health, in addition to reducing the risks of dangerous climate change, as we'll hear from some of the presentations. So let me very briefly introduce the speakers. Robin Fears is the project director, and of course the EASAC Biosciences program director. He has many years, 29 years experience in the pharmaceutical industry in the UK in R&D, and he worked on a range of committees advising UK and EU trade associations, UK government research councils, and so on. And he was an honorary senior fellow at the School of Public Policy at University College London. And of course, he's provided biosciences support to EASAC since 2002. And I want to pay particular tribute to him because he really did an enormous amount of work drawing this all together for the Global Synthesis report. Then we have Victor Ho, who is the working group chair from the Association of Academies of Sciences, Societies of Sciences in Asia. And Victor is Professor of Occupational and Public Health. He's head of the Department of Social and Preventive Medicine and the Faculty of Medicine at the University of Malaya and the Public Health Department of the University of Malaya Medical Centre. He was trained at, his PhD was in Monash in Melbourne, and he also has a Master of Public Health and Master of Engineering from the University of Malaya. So he's a very eminent contributor to the field of occupational and environmental health. The next speaker will be Sherilee Harper, who is the working group co-chair from IANAS, and she is Canada Research Chair in Climate Change and Health, an associate professor in the School of Public Health at the University of Alberta. And she's been in the most recent IPCC report. She's a lead author, and the Sixth Assessment Report. She's been very actively involved in the Gender Task Group for the IPCC, and of course has a specific interest in associations between weather, environment, and public health in the context of climate change. She's also very engaged in intersectoral actions to try to reduce some of the climate-related health impacts. And then we have Deoraj Caussy, who's the working group chair for the NASAC working group. And Deoraj is an independent epidemiologist. He's been offering integrated epidemiology solutions for a whole range of contemporary issues, including, of course, climate change and health. He's been associated over his career with NIH, CDC, and WHO. And as an environmental epidemiologist for WHO, he tackled a range of contemporary environmental issues. I think really triggered his interest in epidemiological risk assessment and management. So it's great that he's with us. I know that I see Jackie Caddo's also in the audience, and Jackie, thanks to you so much for your support and for particularly in your role as NASAC Executive Secretary, and you played a very important role in delivering this whole program so successfully. So without further ado, can I ask them, I think it's going to be Courtney who's going to play the videos of the presentations, and after those we will have a Q&A session. Thank you very much.
It's such a great pleasure to be here today to talk about climate change and health and provide an overview of a report for the Americas. The report was led by the Inter-American Network of Academies of Sciences, or IANAS, as well as the InterAcademy partnership. It's a rigorous report that's authored by more than 29 leading scientific experts from 10 different countries, and we received peer review comments and edits by 19 different experts from 6 different countries. With nearly 700 studies cited in the report, it represents a state of the science assessment of climate change impacts on health in the Americas, as well as potential solutions available that can help us reduce some of these impacts. Now, of course, this was no small feat. When we first started, our team was tasked with assessing the state of climate change and human health across all of the Americas, which is an incredibly diverse region. The region includes different countries, different economies, languages, cultures, geographies, climates, and our challenge was to try and synthesize the state of climate change and health science for a region that includes the Arctic and the Amazon. It includes megacities and small remote communities. It includes coastal communities, mountain regions, and deserts, and ranges from regions that contribute some of the highest greenhouse gas emissions, and it also includes some of the regions that contribute the least to climate change. So this was a huge challenge for our team and for the steering committee. And we wanted to really cover the depth and nuance of the topic, including how climate change was differentially impacting different populations and peoples, but also covering some of the broader and more systemic underlying drivers of vulnerability and risk. So in order to balance covering both the breadth and the depth of climate change impacts on health across the Americas, we took a two-pronged approach. First, we synthesized common pathways through which climate change was impacting health in the Americas, and then we provided in-depth case studies to highlight the diversity of impacts that we've already observed throughout the Americas. So for example, we included 14 different case studies that ranged in topics from climate change impacts on health in a specific region to climate change and health solutions for different regions. And, for example, there was a case study outlining how climate change is impacting water quality in the Caribbean. To assess the state of science and knowledge on the topic, our IANAS report draws on and builds from and really advances previous syntheses, providing an in-depth examination of climate change and health in the Americas and presents case studies to highlight this climate health nexus. Our main target audience was decision makers in the Americas, as well as those whose work depends on or is influenced by the Americas. So we really focused on synthesizing evidence to really inform decision making as our main goal. But we also identified research gaps that have really important policy relevance and implications. So to do this, we really prioritize citing systematic reviews, which use replicable and transparent methods to summarize climate change and health literature. And this is because these types of synthesis studies are often the most methodologically rigorous sources of information and evidence on climate change and health topics. But at the same time, we also cite other literature to illustrate particular topics, specific case studies, or different regional examples. We aim to answer several questions in the report, ranging from identifying the major health risks in the Americas to who's at greatest risk. And while identifying these risks is really critical, we also focus on identifying and assessing potential strategies to try and reduce these risks and to protect public health. And this is exactly how we structured our report. The first part of the report documents how climate change has increased health risks in the Americas. And then the second part of the report focuses on response options to reduce climate health impacts, and we assess those, and we make recommendations that are underpinned by equity, rights, as well as transdisciplinarity to try and paint the pathway forward for climate resilient futures. So what I would like to do with the rest of my presentation is share the 6 key messages and key findings from the report. The first key message is that climate change is impacting health in the Americas now. The health impacts of climate change are not just something that's projected to happen, far in the future. Climate change has already impacted our health today. We know that these key risks include things like heat-related morbidity and mortality, air pollution-related illnesses, nutrition and food security concerns, mental health and well-being challenges, respiratory health impacts, and waterborne, foodborne, and vector-borne diseases throughout the Americas. And the report looks at the pathways through which climate change has impacted each of these health outcomes, and also looks at how these risks might increase in the future under different levels of global warming. Then, for each of these health outcomes, we explore specific adaptation strategies that might reduce these risks. And the key message is that across all of these health outcomes, the evidence is clear. Climate change has already impacted our health, and increased warming will continue to increase these risks. But while we know that specific adaptation strategies are available to reduce risks, these strategies become less and less effective with increased levels of warming. The second key message from the report is that climate change converges with and compounds other health crises. And clearly, climate change impacts on health do not happen in a vacuum, and the COVID-19 pandemic has made this very clear. Our report comes at a time when the effects of the climate crisis on human health converge with the effects of the COVID-19 pandemic. Over the past 2 years, we've all seen how health systems have had to respond to COVID-19, as well as the impacts of record-breaking heat waves, intense storms and disasters, and wildfires. Our fourth key message is that while the health risks of climate change are clear, there are also solutions available. Our report makes it clear that climate change action will improve human health in the Americas. In our report, we address how, through adaptation and mitigation efforts, our health systems can adapt to and cope with current and expected climate change while simultaneously reducing harmful health impacts. So, for example, climate change adaptations include things like raising public health awareness of the climate change and health risks, including improved climate health education in schools. It includes things like making sure that we have robust heat action plans, modifying the built environment to cope with higher temperatures, as well as doing things like explicitly incorporating health provisions into disaster risk management plans. Early warning systems and response systems are also critical, as well as incorporating mental health impacts into disaster risk management. We also highlight how things like integrated environment and health surveillance and response systems, as well as improved access to key services, including improved water, sanitation, and hygiene systems, can also reduce climate change risks. But it's really important to remember that when developing these adaptation strategies to reduce the health risks of climate change, it's also essential that the health sector coordinates its efforts with other sectors, including sectors like water and sanitation, energy, food production, transportation, housing, education, and land use planning. We know that there are a lot of health benefits from adaptation strategies that happen outside of the health sector. But we also know that there are limits to our ability to adapt to future climate change. And while we know that there are feasible and effective strategies that can reduce our risk today, these strategies become less and less effective with greater levels of global warming. And that's why adaptation must come hand in hand with mitigation efforts to reduce our emissions and limit global warming to 1.5 degrees Celsius. There are clear benefits to drastically reducing our emissions to meet the Paris Agreement targets. And our report provides examples of how climate change mitigation can improve health and reduce healthcare costs, both now and decades into the future. So we provide examples of things like the health benefits of phasing out the use of coal, how to modify our transportation systems to reduce emissions, which can also provide environmental and health benefits. And we also talk about how to think about low emissions diets to improve health. Our fifth key message emphasizes that addressing equity and justice really underpin effective climate change actions that improve health. Climate change impacts the health of everyone in a complex way that is often highly dependent on where we live and the subpopulation that we're talking about. An individual's health risks can be influenced by a number of factors, including their current health status, as well as their socio-economic and environmental conditions that they live in, the governance structures in the places that they live, among other factors. And we know that climate change impacts are already distributed unfairly, and they exacerbate insecurities and injustices that are already experienced by vulnerable populations. And many of these are underpinned by ongoing and historical colonialism. Finally, based on the evidence that we assessed in this report, it's really clear that we need to implement an emergency response to climate change. Equity has to be at the core of effective responses, and it must be at the core of all local, regional, and international research, as well as policy responses moving forward. Actions taken now to build climate health resilient futures will reduce future risks. And investing in climate resilient infrastructure, programming, and healthcare systems will help support adaptation and decrease future health risks from climate change. We also highlight how a cross-sectoral and global collaboration is absolutely critical. Addressing research gaps and acting on the current evidence base will require intersectional, intersectoral, and interdisciplinary approaches that bring decision makers together with scientists to pave the pathway forward. So at the beginning of our assessment, the team considered the task of examining the wide range and diverse impacts of climate change on health across the Americas as our major challenge. But as the assessment came together, this challenge actually became our strength. And by examining the wide-ranging impacts of climate change on health, we are able to really highlight and synthesize key pathways through which climate change increases health risks. And by examining and assessing the wide range of climate change adaptation and mitigation strategies that are available across the Americas, we were also able to explore common elements that underpin successful strategies. So in closing, overall, our report shows that while climate change presents clear health risks in the Americas, there are also effective and feasible response options that are available. Thank you.
I'm assuming we're going to go straight on to the next presentation.
For the opportunity to provide this short overview of a major IAP interregional project that will complete by the end of this year. All of our 4 regional academy networks have been actively involved in this project, and there will be more detailed presentations following my introduction. As many of you already know, this project formally started 2019, led by the German National Academy of Sciences Leopoldina and funded by the BMBF. The project was designed to encourage academies to capture diversity in evaluating evidence from their own countries on the impacts of climate change on health. Our objective is to advise on the policy options for identifying and implementing mitigation and adaptation solutions, and I'll come back to that. The EASAC report on this slide from the European Network of Academies of Science was actually published in 2019 and helped to stimulate discussion of the key issues and perspectives and priorities for all the regions and at the global level, and I'll explain how that happened. Since then, this year and at the end of last year, the other 3 regional reports have been published, and I hope you've all had an opportunity to see these. And more recently, the Global Synthesis Report was published, taking account of the similarities and differences between the regions and bringing together issues issues that must be addressed at the global scale as well as the regional scale. So those are the current outputs from the project, and they're all displayed here. All of our reports are now published. In addition to the 4 regional ones and a global one that I mentioned, over the last couple of years, EASAC has continued to work on some of the most vulnerable locations. So we produced, EASAC has produced together with IAP and others, short workshops, reports on issues for the Mediterranean and the Arctic, and again, that they're shown here. We're also actively publishing in the peer-reviewed literature. We have several papers already published and more in press. Coming to the design of the project, we tried to be inclusive in our working group compositions around the world. As I mentioned, 4 regional academy networks, and in addition, involving other countries in some of our workshops. And in addition to these formal working groups, we also, on a number of occasions, sought further evidence and perspectives on the issues and our emerging conclusions in meetings worldwide, organised by ourselves or by other bodies because of COVID over the last couple of years. And indeed, to minimise our own carbon footprint, all of our meetings, except maybe 1 or 2 at the beginning, were held online. And I think this project does demonstrate what can be achieved virtually. Well, the project was designed to compare and contrast evidence and perspectives within and between regions to identify common issues that must be tackled at the regional and global level. And obviously, in order to do that, it's important to ensure that the different working groups started from an approximately comparable starting point with an approximately comparable scope. And it was an early task in this project to agree a set of questions shown here that we would all address in terms of developing and using the evidence base. And I emphasize, of course, that some number of other groups around the world have similar objectives. The particular value of the IAP work, I think, or one of the particular values, was its focus on solutions, that is the options for adaptation and mitigation to protect and promote health in response to climate change. As I think you will all know, mitigation actions target a reduction of greenhouse gases that are responsible for climate change, whereas adaptation is the necessary response to that climate change that cannot otherwise be mitigated. Both adaptation and mitigation are essential, and it's also essential to do better in integrating the various, which hitherto have been conducted really, in many cases, in separate silos of adaptation and mitigation. So that was the starting point for our project. You will hear a lot more about our emerging conclusions in the following presentations from the regions, but just I will summarize here some of the overall messages that can be broadly described. There is no doubt now that climate change is a serious threat to human health, both physical and mental. The impacts are felt worldwide, but are greatest in populations who are least able to cope and have actually contributed least to generating the problems. We do have the knowledge to act. Solutions are within reach, and action can reduce both the long-term risks for health and short-term problems. There is, of course, an ongoing large research agenda as well as the need to use the present evidence base, and our reports go into quite a lot of detail on some of the research priorities. Another major finding is it is necessary to take a regional perspective. Problems do cross national boundaries, and that in terms of doing better to implement the solutions, we do need more evidence on the quantification of different approaches, adaptation and mitigation, their trade-offs and their costs. So in terms of the key overall messages, there are, of course, many differences within and between countries, but overall, there are shared risks on multiple pathways of climate action, both direct and indirect, as shown on this slide. And again, you will hear a lot more about these pathways and their aggregate effects on health, which, as I mentioned, that does include both mental illness and physical health. And again, I use this slide to emphasize that although climate change affects us all, affects the health of us all, that there are certain vulnerable groups who are most at risk. These include populations in LMIC, who have done least to contribute to the problems of climate change, and other vulnerable subgroups within all of our countries, for example, indigenous people, the elderly, women and children. And you will hear about some of these vulnerable groups in the following presentations. Taken together, our regional and global reports describe a wide range of mitigation and adaptation solutions. In this slide and in the next, I present very briefly some of the major adaptation approaches that were brought together in the global report in seeking to deal with the major hazards of heat, wildfires, flooding in this slide. Adaptation solutions are often implemented locally, but it's still important to recognize that we must share the lessons of good practice more widely in order to drive and inform implementation. The solutions often do include nature-based and people-centered, as well as technological solutions. And it's also vital to appreciate that the benefits can only be accrued from diverse action across the sectors. It's not just the health sector that can be responsible for the adaptation to climate change. Adaptation in other sectors, for example, agriculture, urban planning, transport, are vitally important in delivering improved health. So some of the other hazards are listed in the second slide on adaptation. And unfortunately, we don't have time to go through all the detail. I'll just mention one issue that is highly relevant to infectious disease, and that's COVID-19. Climate change and COVID-19 can be regarded, and we do regard it in our reports, as concurrent health crises, compounding each other's adverse effects. But to be optimistic, we can also learn to develop more resilient health systems in response to climate change by learning collectively from our experience over the last couple of years with COVID. For example, in terms of the need for rapid mobilization of resources, global solidarity, and indeed the use of scientific evidence to inform policy. And to highlight one other point with regard to COVID and consequences for future climate change. Following COVID, many promises were made by governments for a greener economic recovery after the pandemic. That is to combine objectives for health equity and environmental sustainability with the financial objectives for economic recovery. Currently, however, many of these green promises are not being kept. This is a continuing issue, and we urge the scientific community to take the responsibility to hold policymakers to account in thinking about the intersection between the response to COVID or other pandemics and the response to climate change and other environmental challenges. Okay, so where are we now? As I mentioned, our reports were all published. We are in the active engagement phase ongoing of interacting with policymakers at national, regional and global level, and with other stakeholders at a different level. Some of the activities are specific for a specific level. For example, the nationally determined contributions and national adaptation plans that are central to national responses. But the core issues are relevant everywhere. And in this Venn diagram, I want to emphasize the issues for climate finance, climate research, and climate justice. And you'll find a lot of detail about these issues in our reports. And we urge, I think, in consequence of this work, that all our academies, together with our regional networks, do have an important continuing role to communicate our collective project messages. As I mentioned, formally the project ends in a month or two at the end of this year, but these issues must continue to be communicated in order to catalyse action. And the project design does actually help integration of the follow-up at the different levels. Some of that is described here in order to inform national, regional and global action. And as I say, this action must continue well beyond the end of our project. This must be a sustained effort because there are unprecedented threats of climate on health. There are also unprecedented opportunities to generate and use the evidence to inform and implement solutions. In my final slide, and as a prelude to what follows, I want to emphasize that our recommendations from the project are not just directed to policymakers or other stakeholders. They are also directed to ourselves in the academies and the scientific community, and to identify our responsibilities to use the evidence base that's already available to help inform policy, innovation and practice, and to identify where the knowledge gaps can be filled by new transdisciplinary and intersectoral research in various ways. And we must, as part of that, improve the evaluation and quantification of solutions. We know the problem. We need to ascertain and implement the solutions. Health professionals and the scientific community have a big role to play in informing these developments. I hope in this session at the IAP meeting, the following presentations will help to focus again on some of these key priorities, will increase the momentum for action. So let me finish by thanking you all for supporting this project. Thank you.
Hello, my name is Deoraj Caussy, and it's my pleasure to be with you today to share the key finding of the African Academy of Science on protecting human health against climate change in Africa. This work is important because we are addressing sustainable development, and the goal of sustainable development is not achievable unless we address climate change. And addressing climate change is a global issue that requires the input of everybody. And I'm pleased to see that there are young academies. The young academies bring a new way of thinking with a paradigm shift. The motivation, dedication, and way of doing things will help us take forward the agenda of climate change and health. We are addressing climate change and health in Africa. In Africa, we have multiple vulnerabilities to climate change. There are a lot of climatic hazards. The traditional one of temperature rise, of ocean rise, of drought, desertification, food security, that is linked all to climate change. And then we have a harsh geography of mostly 60% arid land and 38% desert. On top of that, we have prevalence of high vector-borne diseases that add to the existing burden. And we have low resilience as a whole to deal with climate change because our adaptive capacity is low. The health system responds poorly, and the population have no access to, generally, no other vulnerable group have no access to social support. So in this background, we took the task of looking at what are the evidence for climate change in Africa, what are the gaps in the evidence, and where do we reach the tipping points, and how can we deal with the tipping points by coping strategies, and we advocate for policy changes. I will just use a couple of examples to show you some of the health impact of climate change in Africa. I've taken vector-borne disease, malaria, in the highlands of Africa. We see the temperature and humidity rises. The prevalence on the left-hand side, the prevalence of vectors goes up, and so does malaria. And this is reflected for the projection between the year 2030 to 2050 for the world and Africa. And the vector-borne disease, there are others like chikungunya, dengue, but the most important, again, one of the important one is Rift Valley fever. Rift Valley fever affect both the cattle and the human being, and therefore here we are addressing life and livelihood. I choose another example to show the multiple effects, how one impact lead to cascading effect. I've chosen the heat, drought, and flood, the most direct impact of which lead to crop failure. Crop failure leads to reduced food production, increased food insecurity, and malnutrition. And therefore it puts millions of people at risk for non-communicable disease, in addition to loss of life and livelihood. Indirect effect of flood can also contaminate the water, and that leads to foodborne contamination and malnutrition again. So this shows you how the interrelationship of the cascading effect of one hazard into multiple sectors. The startling finding in Africa, I recommend you to read our full reports where the details are given, but unless we halt climate change, it's reaching a tipping point beyond which it will be hard to recover. There is no central unified policy. That's because there is no cross-sector collaboration. There's limited capacity in policy and program and research. We need international partnership. So the immediate public health package is to have adaptation. Adaptation can only happen when you have an early warning system, such as an EWAR, that can anticipate, forecast, and manage the climate-sensitive diseases. But the EWARs have to be integrated in the national plan, and that can only happen when we include that in the nationally determined contribution. If you look at the map on the left-hand side, you see health is mentioned in nearly all NDCs in Africa, but it stops in here. It just mentioned it. Many countries still have to make a national health adaptation plan, and that is missing. So, taking this into account, our key recommendations are 5 pillars cross-cutting. We need to invest in social capital. We need to strengthen our database. We need to strengthen our policy and adopt adaptation and mitigation, and then forge partnership. Now we have social capital. There's a dire need for social capital. We need to train critical mass of people who can deal with the climate change, the science. We're dealing with the health effect, dealing with the forecasting, dealing with negotiation in international fora. We need data. In absence of data, policymakers are reluctant, or maybe reluctant to make decisions about climate change and health. For that, we need to conduct research. The main way we can strengthen the policy is to have a formal climate change policy by fostering intersectoral collaboration between the health and the non-health sector. We have to find quick ways to promote indigenous solutions, such as switching the lifestyle, eating habit, and cooking habit, or introduce green technologies as far as we can, depending on our level of development. To do all this, we require partnership. We have to galvanize international support for health adaptation. We have to build or to rebuild the green economy in the challenge from recovering from COVID pandemic. It's a tough decision to make. Africa needs additional partnership and resources in knowledge, skills and expertise. The UN and other partners are holding training workshops for building capacity. That is not sufficient. It is a good starting point. Building capacity can happen in many ways. For instance, the report we produce have prompted the Medical Research Foundation to send out a request for £4 million of research in health and climate change in sub-Saharan Africa. And all the people who participated in our report are competing for the grant. So that is a multiplying effect that has to be replicated, duplicated, like a domino effect. Other donors have to follow the suit. We need technology transfer, but most of all, we need financial resources. The Green Climate Fund is not accessed by all members across Africa. In the COP27, we committed $700 billion for Africa. Yet the money is slowly trickling down. We need to move from commitment to concrete action. Climate change is happening now in Africa. It requires global solution. It's a global problem. It's beyond the capacity of most African countries. I wish to thank you for your attention and draw your attention to the main report.
I'm Professor Dr. Victor Ho from the Department of Social and Preventive Medicine, Faculty of Medicine, University of Malaya, and a member of the working group for this report. Today, I'm going to share with you the findings of the work carried out by the Association of Academies and Societies of Science in Asia, the imperative climate action to promote and protect health in Asia and Oceania. Let me share with you the background of this report and my presentation today. The information that I'm going to share in this report is based on the findings from the Imperative of Climate Action to Promote Health in Asia report. It's part of the IAP project on climate change and health, which is funded by the German government. The report is the work of 15 national academies from 7 regions of Asia and Oceania. It is also one of the most vulnerable regions to the effect of climate change. This is because the region has the highest population, 4.6 billion, which accounts for 60% of the world's population. It has countries with the highest population density, has some of the longest stretches of coastal area, which is prone for flooding and rising sea levels. The region's urbanization ranged from 21% in Nepal to 92% in Japan. Topping it out, many of the countries in the region is still largely dependent on agriculture-based economies. The region is also disaster prone from extreme weather events, and due to large number of people and high population density, a large number of people have been affected by natural disaster over the last decade. Since 2000, more than 1.2 billion people in the region have been exposed to hydrometeorological hazards. There were more than 1,200 disaster events happening during this period, which accounts for the global human exposure of 91% of tropical cyclone, 92% of floods, and 66% of landslides, based on per capita base. From 1917 to 2011, more than 2 million people were killed because of natural disaster, which accounts for 75% of the global fatalities. The risk of people exposed to flood or living in cyclone-prone area doubled from 1970 to 2010. More than 60 million people are exposed to flooding risk, and more than 120 million people are residing in cyclone-prone. The major health effect of climate change includes vector-borne diseases and infectious disease, flood and infectious disease, malnutrition, particularly undernutrition and stunting, air pollution and allergies, air pollutions and cardiovascular health effects. effects of forest fire, long-term impact on human fertility, and forced migration and mental health issue has been observed to a different extent among countries in the region. This is also the problem of direct and indirect heat-related effects and environmental toxicants. The health effects due to climate change are different for different countries in this region, depending on the relative changes in the weather, vulnerability of the population, and the ability to adapt to changes. The only certainty is that climate change will change the pattern of disease affecting all countries, either from direct or indirect effect of climate change. The direct effect of climate change include heat, exacerbation of pre-existing health condition, or increase in hospitalization. Heat can also exacerbate pre-existing respiratory and cardiovascular condition. The effect of heat does not only depend on absolute temperature, but also on a relative change in temperature. In New Zealand, condition where the temperature is above 25 degrees is considered hazardous and leads to increase in heat-related morbidity and mortality. Heat can also cause indirect health effect and of pre-existing medical conditions such as cardiovascular and respiratory condition, mental health and diabetes. People with pre-existing medical condition may be more prone to develop heat exhaustion and heat stroke. With more and more people moving from the rural area to live in cities, urban health island will become a problem in the future. For example, in Australia, 90% of the population that is living in urban areas will be affected by heat. The heat vulnerability index for Australia is also high and on an upward trend. An increase of 1.25 to 2 degrees Celsius will lead to more than 27,000 heat-related deaths annually, out of which 830 million urban inhabitants in China will be affected. Impact on health services, increased ambulance call-outs, slower response times due to heat stress, increase in hospital admission, increased accident, example drowning, work-related accidents, injuries, poisoning, increase in transmission of food and waterborne diseases, and the bloom in marine algae. Potential disruption of power, water, transport, and decreased productivity. Increased heat also affect outdoor workers like agriculture and forestry, fishery, leading to heat stroke and decrease in productivity. Cold events can occur due to the effect of climate change and pollution. Smog formation from human activities was attributed to the increase in cold wave in Nepal, with 58 locations affected in 2010. Bangladesh also seen severe cold events in the past 2 decades, and in China, cold-related mortalities outnumbered heat-related mortalities by 20 times. Forest and bushfire can occur naturally due to prolonged dry days and reduced precipitation and high temperature. It can also occur due to human activities or biomass burning and agricultural activities. It is a recurring issue in many countries in the region, including Australia, Armenia, Azerbaijan, Indonesia, India, China, Malaysia, New Zealand, Singapore, and Turkey. Fine particles from fire is hazardous to health and can travel very far, even across sea. The fine particles from fire in Australia has been found to cross the Tasman Sea to New Zealand. Similarly, fire in Sumatra, Indonesia has crossed the Strait of Malacca to Singapore and Malaysia. There will be increasing forest fire and more people are affected by fires. Here are some examples from China, India, Turkey, and the Russia Far East. Flooding is a major issue in most countries in this region. Global warming leads to excessive precipitation and increased sea levels. Excessive melting of the Himalayan glaciers leads to flooding in Nepal, India, Pakistan, Bangladesh, and Bhutan. The Ganga originates from the lake in the Himalayas. More than 400 million people live in this river basin. In China, half of its people and 2/3 of the land falls under heavy threats to flood. In the last 30 years, the frequency and severity of extreme floods have increased in China. Floods have also been affecting many countries in this region, including New Zealand, Armenia, and the Russia Federation Far East. The threats of changes in the temperature, precipitation, increase and decrease, and humidity leads to profound impact on the life cycle and growth of infectious agents and vectors. It can lead to the impact on access to clean water, and increase in polluted water can also increase the threats of infectious disease. Here are some examples of issues faced by countries in the regions. Pakistan has the highest incidence of typhoid fever in South Asia. In Nepal, the outbreaks of flood and waterborne diseases is becoming more common, the risk will increase in temperature and rainfall. In India, the issue is the lack of access to clean water, which is further worsened by depletion of groundwater due to global warming and drought. The changes in temperature has led to the change in the exposure to pathogenic microorganisms as shown in Korea and Japan. Next, we come to the vector-borne diseases. Some of the vectors including mosquito, ticks, flies and fleas. The changes in temperature has led to the emerging and re-emerging of vector-borne diseases in areas and countries where previously it was not an issue. In many of the temperate countries like China, Japan, Nepal, Armenia and Pakistan, the Aedes mosquito are now present in their environment. Climate change will lead to higher risk for food insecurity and malnutrition. Studies have shown that the elevation of carbon dioxide levels can impact on nutrient concentration in food, which can lower the iron and zinc protein levels in plant-based food. Many of the countries in the region still depend on plant-based food. Rising sea levels, temperature also correlate with the microorganisms and biotoxin levels in seafood. It also increased the rate of methylmercury formation. In countries where seafood is consumed widely, like Japan, New Zealand, this will become an issue. Malnutrition and anemia is a major health threat in both developing and developed countries. In developing countries, chronic malnutrition can lead to stunting, wasting, and underweight. Stunting is a problem in South Asia, particularly in Nepal, India, and Pakistan. Adaptation and mitigation options. The importance of communication across different sectors, development of pilot early warning system for heat wave and health risk factor, research and studies on prevention and control of climate change-related diseases, enhancement of health and care systems, social transformation to help promote awareness and control, to improve water quality and sanitation and hygiene levels, development of technology for adaptation and optimization of the agricultural sectors. Common challenges in Asia and Oceania: low public awareness, insufficient research, inadequate data and limited access to data, limited health care facilities and resources, insufficient financial and economic support, impact of high financial disease burden, especially on the poor. Conclusion: climate change is happening on a wide regional scales and escalating. Climate change effect on health through multiple pathways. Identifying regional variation on impact, solution, science-based evidence and avenue for regional cooperation for mitigation is required. Identify new research area, increase transdisciplinary and intersectoral information sharing on the outlook of public health issues associated with climate change is encouraged. Accumulate and the use of evidence on the health impact of climate change from reports and emphasize the basis of coherent health policy development for climate change mitigation adaptation strategies. Increase the responsiveness of health to the health impacts of climate change, as well as promoting action that improve health while reducing greenhouse gas emissions. Clarify public health issues associated with climate change that should be addressed through multilateral collaboration. Highlight the common needs for national planning. Dealing with new and emerging health issues in Asia and Oceania in the face of climate change, a common solution or one-size-fits-all may not solve complex problems faced by people in different socio-economic and political systems. Recommendation: the report recommends that we should increase education and training, research and knowledge implementation, develop an integrated healthcare delivery system, support government in policy of development, and provide financial aid and adequate resources. Thank you very much for listening to this presentation.
Well, thanks to all the speakers for their very compelling presentations. And we now have an opportunity for some open Q&A, and we've already had some excellent questions in the Q&A, and feel free to add more. I'm going to pose these questions to the different panelists. The first one of them is from Rula Abdel Masi, and she represents the TWS Young Affiliates Network. And she talks about the importance of making sure that climate change is not politicized and misinformation is spread, as frequently happens. We will ask maybe some of the speakers to address this issue. And of course, we've already seen the impacts of misinformation with regards to vaccines. There's also a question about Volker, and I know Volker is going to come in. I think Volker's going to come in with some concluding remarks, so I will turn to him later on. So first of all, then the question about how do we reduce, and we can't stop completely, but how can we reduce the politicization and misinformation about climate change? What are the lessons we've learned from COVID? I don't know who would like to have a first go at this, but can I invite some of the panelists to respond? Robin, do you want to have a first crack at this one?
Yes, thank you, Andy. And indeed, it is a core part of the reach out activities from this project that I think we will talk about further to ensure that our messages are evidence-based. And of course, we draw on, as you've heard, on a wide range of scientific evidence and other knowledge sources. But ensuring that the messages are clear and are evidence-based, we engage in various ways, particularly with policymakers, and I think we will come back to that, but with other stakeholders and audiences. And of course, we're also, as a global project, that very much dependent on the activities of the individual academies around the world to use the information in the resources that we've accumulated at the national and local levels. And of course, here also the emphasis on countering misinformation is extremely important, whether that's in social media, the other media, or the other daily activities of the academies. And that's actually one of the strengths of a interregional global project such as this, that we can integrate follow up at the various levels through the academies in a wide diversity of societies. And I'm sure my colleagues from the regions can exemplify some of that follow-up activity.
Thanks, Robin. Could I actually turn to you, Jackie? Because you know, to ask you to give your perspective from NASAC about how you address the issues of misinformation, disinformation in the African context.
Let's see. Can you hear me?
We can actually, yes.
Okay, so maybe I just give my finger.
So you're muted, but we can actually hear you. So.
Okay, okay. So I think the issue of miscommunication and so how we address it is to try and get, you know, when we produce the scientific reports, we try and get lay versions of it so that you have a version that is non-technical and devoid of scientific jargons. And then you try and hold communication, webinars, communication, in-person meetings, do focal point interactions, and just try and debunk those myths or unravel the misinformation. But I think something that has become clear over time is that the counter of misinformation is to actually get the good information out there. So you have to engage alternative platforms when you do not have formal opportunities to be able to address that, and therefore engaging the social media aspects of issues, or being able to, not contradict, but put out a statement that would clarify that point of information. But it is a general issue, and not just, and I think it has come up so rapidly during the pandemic, that it is an issue that we constantly have to do different things about. So I stop there. Thank you.
Thanks so much, Jackie. And I think also it's where our early career colleagues can often help, because they're often much more adept on social media than the people in mid and late career. So this is a really important role, I think, for early career colleagues. Do any of the other panelists wish to comment on this issue of misinformation or disinformation? Or, yeah, Sherilee?
Yeah, I'll just make a quick comment. So I think that this is actually a role that health scientists could play a leadership role in. We have tackled misinformation from tobacco. COVID was used as an example for misinformation. This is something that the health science community has really grappled with for a while. So I feel like we could apply some of those lessons learned in that discipline to climate change for both the health impacts on climate change, but climate change more broadly. And I say this as somebody who's sitting in an oil producing area of Canada, and also, next door to the United States, where a lot of misinformation has been coming from vested interests, but is also the power of these reports. The group of scientists that have come together through the academies, we don't have a vested interest. And so I think that that's one of the things that makes these reports really powerful. And then my final comment, I just wanted to give a nod to the European report that was part of this series, because there's a really strong section in that report that talks specifically about misinformation and steps that can be taken to try and combat that. Thanks.
Great. Now, anyone else wish to comment, or we can move on to other questions?
Yeah. And
Victor, you want to come in?
Yeah, basically, I think the other things, we need to work together with all the other non-governmental organizations, and all the local people that actually are the one that actually going to make the change. And the scientists itself actually cannot make the change by themselves. And we need basically grassroots people actually who demand that the politician actually make changes. And that is the only way to do it at the ballot box. And that is what we are trying to do. And there's a lot of many groups in Malaysia are basically, or in this region are looking at it from that perspective. I think being alone here, we cannot do anything. Even we need to engage the local NGOs and tell them how climate changed and how to adapt and mitigate, and how the politician actually can help. Thank you.
Thank you very much. Let me move on to some other questions now. Martin Dominic asked a very specific question about were no Arabic-speaking country involved in this, and perhaps I'll turn to Robin on that, because there's the Cyprus report which does partly address that omission. And then let me also include the questions by Jacek Kolonovsky, who asked an important question about the selection of experts to the work groups and how diversity of different perspectives was ensured in the different regional reports, in addition to the geographic diversity. So let's take those two questions together. And I know that Jacek's also asked another question, but I'll come to that in just a moment. So first of all, Arabic-speaking countries. Secondary, how did the various regional reports ensure diversity within the region? And I assume that means, gender, age, geographical diversity, everything. So, yeah, first of all, a very factual question. Robin, do you just want to respond on the Arabic-speaking countries, because there's a factual?
Yeah, thank you, Andy. I think that in a lot of the activities of the academies and IAP, there is a problem that some of the Arabic countries in the Middle East are not well represented in the academy networks. And I think that was reflected in the regional working groups. But with regard to the specific region of the Middle East and the European Mediterranean, as a number of you know, we did organise a workshop together with the leadership of the Cyprus Academy to bring countries together from the Middle East and the adjacent regions. So, for example, in that workshop, we had representation and views from Jordan, Lebanon, some of the countries of North Africa, Tunisia, and Algeria, for example, Egypt, and other countries in the Middle East, such as Iran, have also been represented in our working groups. So we did try to increase the representation of Arabic-speaking countries, but I think it is still an issue for the IAP family to spread its activities in that region. Just a word on diversity. Well, in addition to the geographic diversity that you've seen, and I think we did reasonably well on geographic diversity. Of course, the working groups also were composed on the basis of different scientific disciplines. So the scientific diversity and experience of the working group members. In terms of gender balance, I actually will leave it to the working group leads, but I think that they were reasonably gender balanced, particularly I think Africa and the Americas and Europe. Asia perhaps not quite so much. So yeah, I think I'll leave it there. I can't think of any more diversity.
Let me turn to the working group chairs to maybe respond to the issue about diversity in all its forms. So let me turn to you first, Sherilee.
Yeah, I'm happy to answer this question. We tried to take a number of things into consideration. So the first is that as the I guess like the co-lead of the report, I am an early career faculty member, so I fit that early career stage, and I'm also a woman. And so these were two things that I were definitely on my radar. The other thing that I was very attuned to was other intersectionality. So things like Indigenous people. We tried to engage as many Indigenous people in the writing of the report as possible. We tried to ensure geographic coverage of the report as much as possible. We had a fair number of women who were authors on the report. Invitations were sent to the different academies, and those went out to their membership to try and recruit people. And then in places where we had gaps in terms of authors on the report, we tried to fill those gaps by inviting reviewers from those different intersectionalities to help contribute expertise and make sure that we weren't overlooking those things. So we tried to capture diversity in terms of age, gender, career stage, geographic location, as well as other intersectionalities, both in the authorship of the report, but also as in their peer review process.
Thanks, Shirley. What about Jackie, Deoraj? Would you like to respond?
Okay, because
you want to come in first, then, Jackie? Yeah.
Yeah. Okay. So I think because we are a regional network, our first call goes into our members to try and nominate members of the working group. So when that is done, and we ensure, I think both my colleagues have mentioned the inclusivity in which those nominations are selected, then we try and accommodate, and I think Sherilee mentioned that, try to get other relevant expertise, relevant geographical areas to be involved through a peer review process. And then third and not least, which is also what we do at NASAC, is at the point of endorsement, you get all your members to endorse the project. So for the network in Africa, we have Egypt, Algeria, Tunisia, Morocco, being part of the membership and also contributing not just expertise in reviewing the project, but also in working group members, so to speak. Then I think so that answers the Arab question, and I think also touches on the inclusivity questions. Deoraj, unless you specifically want to say something, thank you.
If not, shall we move on to Victor?
No, it's good. It's good.
I think for our Asia perspective, basically we asked the members, we asked the association and the academies from the Asia region to provide their representative. So we did not, and the representative are as diverse as we can get, because they are from different regions. On the diversity of gender and other grouping, basically gender. There was the issue with gender. We have more males than females contributor, but we try to ask female contributors from certain regions, but there are some gender issues in our report. But I think that that is something that difficult to avoid, because the representative comes from the academies of each countries. They send their own representative. So it depends on the countries which representative they want to send, and we will accept that as their representative. Thank you.
Okay, thanks very much. Let me move on to the next question then, also from Jacek Kolnowski. The point here is about the real challenge of communicating to catalyzing action and the problem of getting uptake of recommendations by policymakers, which and I agree, is probably the biggest challenge. So what the question is really, which type of outreach activities you found the most effective in helping that communication, building cross-sectoral, trans-sectoral collaboration, and which of the challenges of the communication of the report are still remaining, are still the biggest challenges. So perhaps I can ask people to comment on this issue of policy, research into policy, evidence into policy, and of course from policy into practice. We also know there's big gaps between what happens in policy and then what happens in practice, and what are the most effective strategies for bridging those gaps. So anyone like to respond first on that one? Volker, you need to unmute yourself, please. You're still muted. You're still muted, Volker. Can you unmute yourself?
Thanks very much. Can you hear me now? Can you hear me? Can you hear me? Is now? Is it possible? Okay. Okay. So I would say now that there's an echo.
Sorry, we're getting a big echo, Volker. I don't know if someone's left their mic open or whether it's just yours. Have you got a couple of mics open in the room or no?
No.
We're getting a very big echo, so I'm afraid we're going to have to try and sort that out somehow. But
Try it now, sir. Try it now. You've muted yourself now.
Try now, Volker. Oh, unmute.
I don't know what happened.
No, sorry, it's still very, very echoey. Okay, let me move on to some of the others and see if you can also, if you want to put a response in the typing as well, Volker, you can just type a response in the Q&A box.
What I suggest is they should send me a new link. That I would send you the link and I'll join you again.
Sorry, I didn't get that, but if you turn the volume down, that's a suggestion. Maybe the volume, if you pull the volume down, it might help.
I think no. Basically, he got two mics there. One of the mics is picking up the echo.
It seems like it, doesn't it? Yeah, it seems like two mics in the room. Yeah. Okay. Well, let's move on to some of the other panelists. So, yeah. So other comments, please, on policy. Robin?
Yeah, well, let me just say a couple of things while we're seeing we can fix Volker's. Sorry. And of course, the question goes to the heart of IAP's strategy for science advising policy. So clearly this is a major issue for all of us in IAP. And indeed, it is a specific internal objective for this project. In addition to the external objectives to advise policy, there is an internal objective to try and share good practice for capacity building at the science policy interface for those academies that may be newer or smaller and have less experience at doing that. So we are very conscious of the need to face the challenge of outreach and engagement. Just a couple of points, and of course we could talk about this for a long while. But one thing that we have learned is that if you want effective engagement at the policy level, you don't wait until the end of the project to communicate and say, oh, look, we've got some outputs that we think might be of interest. We engage with policymakers right at the beginning, but that's relatively easy in Europe, where there are European institutions, policymaking in the European Parliament and the Commission, that there are not equivalent institutions elsewhere. So it is relatively easy to build that early engagement in Europe. But even elsewhere at the global level and in the other regions, throughout the course of the project, we have engaged with regional and global offices of UN bodies such as WHO, FAO, and the UN Economic Commission to tell them what we're doing, to get their views on some of the issues, and to prepare them for our final outputs. Outside of the UN, we work quite strongly with the S20 part of G20 in a similar fashion to inform them about the nature of the project, our objectives, and our emerging messages. It is, of course, I very much agree, it's a continuing challenge to do this because, of course, the need to do it doesn't disappear at the formal end of the project, which in this case is next month. So it is a challenge for IAP, regional academy networks, and the individual academies to continue to allocate resources for outreach and engagement on a longer term basis. I'll finish there, but I'll just emphasize that one other way that we've found to be effective, I think, in this project, in being distinctive, is to focus on solutions. There's a lot of other bodies focusing on the problems, quite rightly, but here we are focusing on, well, how can science help? How can the scientific opportunities help to generate the solutions?
Okay, thanks very much. Let me try to bring Volker in again if we've solved the technical problems. Volker? Sorry, now you need to unmute. No, still muted. Okay.
Hear me now?
Yeah, but unfortunately we've got the echo back. Try again.
Can you hear me? It's challenging. I will bring my mobile phone out of the room.
I don't know what the problem is, but sorry about that. Okay, so let's try Jackie, Sherilee, Victor. Would you like to comment, or Deoraj? If you could unmute yourself, Jackie.
Not on the laptop.
That's it. Now we can hear. Good. Yeah.
Okay. So I think I just wanted to add to what Robin has mentioned is the inclusivity of the policymakers that you want to influence at the beginning of the report and not just the end. But I also wanted to add that once we as a regional network produce this report, which is from a very regional perspective in the sense that at the end, you will only see, for instance, references to case studies that have regional solutions, specific mention of countries that where solutions or ideas of how they tackled certain climate change issues that related to health that worked. They still need to be localized. And that means that we engage our local academies in different countries. So for instance, we will launch the report in Kenya and get the National Academy to get the leadership from the Ministry of Science and Technology, the Ministry of Health, the Ministry of Environment, be party of that discussion and being able to see how Kenya specifically can use the report to better make informed issues when it comes to dealing with the issue. So besides the regional engagement and the global report is the in-country work that needs to go into that to make the report relevant for country-specific policies. And therefore, I also agree with Robin that additional finances and resources in terms of manpower need to be engaged, because when you go in country, you need the experts of those nations being able to speak to the report and in a way that is very nationalistic, you know, like they're able to solve in-country solutions using the report. They're able to draw references of where solutions worked well, and then still be able to see how in terms of regional, their own experience and expertise can also contribute to the regional level. And then for us at the network level is to be able to engage the African Union, the regional economic commissions, as well as even the UNECA, the Economic Commission, also get a chance to be able to draw the report for Africa-wide decision-making. So I think that's what we'll do to ensure that at least policy gets to implement some of the recommendations that our scientists have made. Thank you.
Thanks, Jackie. Could I just say something about COP27? Because now that that's in Egypt, it does give a particular opportunity, I think, to feed in to Am I muted? I'm not muted, actually. Nope. I haven't muted myself. Can you hear me? Yeah, okay.
Yeah.
Sorry, I had a message saying I was muted, but I wasn't muted. So, yeah, just to say COP27, could you just comment, Jackie, about whether there are opportunities, particularly of COP27 being based in Africa? Oh, sorry, somebody's muted me because I've not muted myself.
We can hear you anyway.
Oh, but they can't. So I don't know what to say about that.
I think they have removed our.
Yeah, I think Courtney removed us.
Can you hear me now? Can you hear me now?
I can hear you, yes, but they
No,
can't.
And there's no echo now.
I have solved it. It was not my problem. It's the problem of the arrangement.
Can anyone hear us? Jackie, can you hear us? Oh,
yes,
you can.
Now we can hear you again.
Okay.
Good, great. Okay. So my question really was just before I hand over to Volker. Jackie, what are the opportunities for COP27, given that it's based in Africa?
Thank you. Yeah, I think we have a great opportunity there, and especially that is being hosted in Egypt this time around. And Deoraj and I have the opportunity to participate at a side event at the WHO Pavilion. And we'll be able to not just speak about the report, speak about how to engage it, but also be able to publicize the lay version of it, what we call a policy brief. And at the end, and like many of these conferences, it is an opportunity to network, to get the people who make those decisions, get to hear what our scientists are saying as possible recommendations for countries to move forward. So indeed, for us in the continent, we really look forward to an opportunity to be able to talk about the scientific work that has gone into producing the report, but also to avail the lay version of it that is devoid of the scientific jargons, and also draw attention to specific case studies, especially those success stories that we want to highlight for other countries to emulate. Thank you.
Great, Jackie, thanks. So let me now bring Volker in. Hopefully this time it's going to work.
Okay, should I make concluding remarks, or you're still discussing?
I think we have a few more minutes. Do we have a few more minutes to deal with one more question, or?
We need the session to finish exactly in 7 minutes.
7 minutes. Well, do you want to just quickly respond to the communication issue then?
Well, I would say Robin has already pointed out, and I would say what has worked quite nicely, if there's a possibility, and I think Jackie was telling it too, to define the questions you want to address from the political need, whether it is something on their table. If they have a problem which they cannot actually, they don't know how to address this, then I would say we as scientists can move in and give scientific explanation to these problems which occur. And this has worked quite nicely in Europe. And I would say we have established quite good links in Europe to different ministries and the European Commission and with colleagues in the Parliament. And I would say this has also worked in Africa. We had once a big project on genome editing and GMO, and we were invited by the African Union, and we went to the African Union in Addis Ababa, and we could present our findings. And this is something, of course, which is wonderful if you have an organization like in Europe, where you have a big center of politics, where you can go and address the problem, or in Africa, where it's also the African Union, where it can be addressed. In other countries, it is, or in other continents it is different, but still from the very beginning to have an early contact to the politician in questions, I think it is always very helpful.
Well, thank you very much. I'm very aware we are running out of time, but there are some excellent questions in the Q&A which I'd love to address, but I feel we are running out of time. So maybe I should ask you now, Volker, just to deliver your closing remarks, and perhaps we can.
Short, if this is a burning question, you can answer.
Well, there are a couple of very specific ones, which maybe I could ask one person to deal with each one very quickly. First of all, there's one to Victor about the problems of data collection, particularly in low-income countries. How can we actually develop better data collection systems that would allow us to assess more effectively the impact of climate change on health? So that's one. And then another issue which has come up is the issue of the climate injustice and the fact that the populations who suffer the most contribute least to the problem. And so if maybe somebody, maybe Jackie, could very quickly in a few, a minute or so, address that issue. How can we make sure that that's addressed in climate change negotiations? And then I will hand straight to Volker to give very brief closing remarks. I know we've got to stop.
Okay, let me start. Basically, the data collection is not just about data itself, but also availability of data. I think to get to data collected properly, then technologies need to be contributed from a developing country of how to collect data correctly. But that technology doesn't mean that when data is there, the data is available for scientists to actually work on it, because a lot of government actually are very restrictive of their data, and that is something that I think if the global data is available and global, how can we use global data to look at local issues, and that needs more collaboration from the developed country or to help the less developed country. That is my conclusion.
Okay, thanks so much, Victor. Look, I've just had another message saying we've got to leave time for a poll, so we really have run out of time. So they're excellent questions, and but we will probably need to deal with them perhaps in writing later on. Volker, can I ask you to make some very brief concluding remarks? And then Peter, do you want to do the poll at the end after Volker's spoken, I suppose?
Let me just make some comments to why we started this type of analysis. Why did we involve the regional networks? If you look back into the history, IAP was founded in 1993, and eventually it was a growing group of international academies realizing it is more and more important to give science advice to politics and society, not only where you live, but also in your region, and from the region then globally. And in IAP, these regional networks developed independently in the different continents, but have never worked together since about 7 years ago or 6 years ago, when we started to do this for food and nutrition security and agriculture, a big topic which is similar important as climate change and health. And we were received additional funding, and the basic idea was bring as many scientists together in the different regions that they can analyze the problems in the region which are there. And then we have 4 independent reports from each continent, from each region. And in this one, the major questions were defined in the very beginning. What do we address and what do we not address? And then we had these 4 reports, and from these 4 reports, actually then a global report can be prepared. And the global report actually compares similarities and differences, and also points out in which way globally the problem can be attacked and globally can be advised from a science point of view. And I would say this is what has been very successful in our first trial in food and nutrition security. Robin mentions this, that we were invited by the United Nations to participate in the science advisory body to the food summit last year. And also in climate change and health, we have invitations to the COP, and what was already discussed. And I would say this is something we should continue, because you have to remind you that we have now over 160 national science, medicine and engineering academy joining us in IAP, And that is about up to 30, I think 35,000 scientists with all different expertise, which can be used and which can be brought together. And since all major questions coming up now, which we have to deal with, but also in the future, they have to be globally addressed. It cannot be solved anymore individually in a different small group. And I would say, since there is not an IPCC group like for this type, what we are doing, I think IAP can take up this role and try, which is knowledge and which all the expertise we have to handle it. I would like to conclude by thanking all speakers. In particular, I want to thank my co-chair, Andy Haines, with a tremendous help to bring this entire project forward and to such a good end and to which all the activity. Robin Fierce, of course, as a major program director who has helped always each of the regional network when it was necessary. And I personally must admit, I enjoyed it very much. And my last wish is to IAP as an organization, keep going with this type of analysis. It is the best way to be visible nationally, regionally, and globally if we continue this type of analysis. This is my personal experience, and I hope it will be heard by my successors and that they will continue this. Thank you very much.
Yes, hello. So the poll will remain open for 3 minutes. So please take your time, fill in the questions, and please don't leave the session until you've completed the poll. After that, you should disconnect and come back for the next session.